Next, we want to tee up Calroy and Dr. David to tell us about the journal and how you can contribute that way and contribute and share. Yadin?
Tom, it's great to be with you. Somebody need to get my video open up since I cannot do it locally somehow. Anyway, I'm going to be joining what you start telling the group about the last 2 years of leadership that you projected into this community. You're doing a great job, Tom, and as a result, we all are energized and get closer and closer together. And with that, what you realize, getting closer together, is that we need the tools to be engaged. And one of them that is recently becoming a success story is the Global Clinical Engineering Journal. This online Diamond Open Access journal is basically stating that to maintain peer-reviewed manuscript and publication that are available without charge to both readers and authors are quite unique in the field today. And what I'm happy to do is to tell you that as the editor-in-chief of the journal, and with the help of Calroy Stavriano, that is the journal manager, we're looking forward to have the vision that the journal will become the preferred international publication for exchanging information relating to technology in healthcare around the world. And we're marching towards that vision by setting goals to advance and disseminate knowledge, to promote professional networking among clinical engineers all over the world, and to share that with other stakeholders in academia. We are able to do it by selecting specific topics. And by selecting those topics, we want to help you, the readers, the authors, and the reviewers, to be part of the Global Clinical Engineering Journal. So let me tell you very shortly about how you can make a submission and how easy it is for you to become engaged with the journal. On the right-hand side, there is a column that regardless what page of the journal you're on, it's always there. You can select make a submission, and in make a submission, you are becoming a potential authors. You need to register, and once you registered, it's very easy for you to follow up the steps. It's all very clear and self-directed. If you do have an area of expertise, what we ask you that in addition to being a reader or a submitter, that you tell us that you would like to become a reviewer for submission of other people material, and tell us the specific area of expertise that you hold so we can guide the appropriate paper for your review. This is an excellent way of getting engagement by becoming a reader, by submitting manuscript, and by volunteering to become a reviewer. I would like to show you a little bit about the submission flowchart, if you will. If you go to submission, you can see that the author guides have several hot links, and all of them are involved with simple table, graphs, and instruction on how to progress. If you find that there is some difficulty and somehow you cannot progress to full submission, don't worry. The rumor, I'm going to tell you quietly, rumor is that Calroy Stavriano is sleeping only 2 hours a night. Please contact her and she would help you regardless what time zone you're on. She would be able to guide you and she would help you like she helped everybody else who needed help. Let's visit some of the journal that we have, for example, current issue. If you are coming to our website and you look at the home page and you blow it up to a full, thank you, for a full view, you will see the current issue celebrating clinical engineers around the world as silent hero. And you can flip, just like holding a real physical journal, you can flip the pages and you will have hot links directly to every published article, to all the references and all the tables. You can have it immediately in front of you. Very interesting platform, very helpful. We also have an opportunity to have what's called First Online. This issue has been published and is already complete. But in order to avoid manuscript waiting for the next publication date, we have Online First module, which continuously and without delay, listen to that, as soon as you have a submission that got reviewed, all the revisions applied to and are ready to be published, we publish it online first, like you're seeing here. The articles you're seeing here are not a part of an issue yet. That will be the next issue when the time comes for publication. So if you go and look at this, this is the cover page showing the iron lung, celebrating almost 100 years for the invention of the mechanical ventilators and the important tools during the COVID-19 fight of the virus. But if you look at that, and you look at one of specific paper I want to show you, is that we publish a guide for how to submit a manuscript to the Global Clinical Engineering Journal with all the details for you to understand, for example, how do you select a title? What should be part of the abstract? What are the keywords? How do you address methodology, results? How do you write conclusion? How long should it be? And provide you references to it. I'm sure that you will find that once you try it, you will be coming back and back again with additional public manuscript and submission. I cannot finish without telling you about the editorial board. Again, on the right-hand side of your page. I'm really proud to have such an elite group of professional people that represent the clinical engineering practice area, the clinical engineering academic area, the World Health Organization, and other professions such as physicians and surgeons and pharmacologists who join us on the editorial board from all four corners of the world. You can click on any of the names that you see there and you can immediately jump into their bio, and it will be exciting to see their background. I'm really proud of this editorial board that we have. From Brazil, from the UK, from Canada, from the US, from China, from India, I'm telling you, South Africa, and so on. It's just fascinating to see the broad spectrum that's represented there. I'm honored to be part of this team. And I would like to make sure that you have opportunity to ask questions and that we have the time to respond to it. But engage, become a reader, submit, become a teacher, promote the journal to other colleagues, and therefore network and influence the profession. And finally, make sure that we are in touch and on target by writing us letters and response to the editor corner. So you have an opportunity to tell us if we have missed something and if there is something else that this journal can do for you. This is an independent journal. It's double peer-reviewed, double-blind peer-reviewed, and it's looking forward to be your preferred publication house. Thank you very much.
Yadin, you guys are not only deep, but you're also fun. I mean, you're fun to be with.